have my acoustic neuroma treated with surgery or radiation, how often should I get MRI scans?
So this is a very common question. How often do you need to get MRI scans after your acoustic neuroma has been treated with surgery or radiation? And there's not a standard guideline that is uniform across all institutions. So the decision tree that I use in terms of obtaining follow-up MRI scans depends on a number of factors, and that's related to the type of treatment. So let's talk about surgery first. If you had surgery for your acoustic neuroma, how frequently should you get MRI scans? And this depends upon certain things. Was all the tumor able to be removed with surgery? If all the tumor was removed, perhaps you don't need to obtain MRI scans as frequently as you would if a portion of the tumor had to be left behind on the facial nerve, for example. After surgery, we often follow the patient symptomatically, and if new symptoms develop, then we consider, increasing the frequency of MRI scans. We also look at how far the patient is from surgery. Typically, we obtain the first MRI scan within a few months upon completion of the surgery, but once a patient is 5 years or even 10 years out from surgery with a number of MRI scans that all look stable, the frequency of subsequent MRI scans does not need to be as close together as it did immediately after surgery. In terms of MRI scans after radiation treatment, such as CyberKnife, it depends upon how large the tumor was to start with. In larger tumors, I typically recommend a closer follow-up, mainly because the larger tumors can exhibit some swelling as they die from the radiation. As with surgery, if a patient develops new symptoms during the follow-up period, MRI scan is reasonable. And as with surgery, the further out a patient gets from their radiation or CyberKnife treatment, the less frequently you need to obtain scans. Now, one variable that comes up when determining follow-up MRIs on patients is also kind of the anxiety level and how concerned the patient is. Some patients with acoustic neuromas very concerned even after treatment, and they're anxious and they want more closer monitoring. Other patients don't like MRI scans because of the narrow fitting of the tube and would rather as few MRI scans as possible. So we try to factor that into the decision tree and determining the frequency of MRI scans.